My name is Dr. Troy Randle. I am a cardiologist with Virtua Cardiology. When coronavirus or COVID-19 first came out in the spring of 2020, we really did not know what to expect. We've heard kind of worldwide what was happening, especially in Europe. We thought of it as a respiratory virus initially, and subsequently, we found that it was much more than a respiratory virus. I had the experience of being able to see both ends as a practitioner and taking care of patients that had COVID-19, as well as my personal experience with COVID-19 itself. From a physician standpoint, as a cardiologist, we found very early that we were dealing with different heart arrhythmias. So people were having irregular heart rhythms, and some of that may have been a strain on the heart because of the oxygen levels that they may have been experiencing low oxygen levels and put an extra strain on the heart. So we were dealing with that, as well as people having heart attacks early on. And then subsequently, late March, early April, I found myself being a patient with COVID-19. One day I came home, and soon as I got out of the shower, which was like part of my normal routine after work, before I interacted with anyone, get undressed in the garage, take a shower so I didn't expose my family and everything. But soon as I got out of the shower, I hit a wall. I had headaches, feverish chills. I struggled to get to the bed, and the headache probably lasted about 2 days or so. Feverish chills, body aches were off and on for a good probably 5 to 6 days early on. As that passed by, I thought that I was recovering, doing better, cleared to go back to work, and then 2 days into resuming work activities, the headaches resurfaced. So then I'm like, what's going on? Is this virus coming back again? I thought I was over it. But this time the headache was just relentless. It was like a vice squeezing. Tylenol, Motrin wouldn't subside any of it. I had some periods where I had some weakness and lost of judgment. I prayed, took walks, and then subsequently, my wife, just broke down because she couldn't see me in that position. I'm usually the stoic individual in the family. As a man of the house, you try to show strength to the wife as well as the kids, so don't show the weak points. But she usually doesn't see me like that, and she had her emotional breakdown, which then I decided to go to the hospital, and that's where I found out that I had a stroke from COVID-19. At that point in time, we were not aware that there were some individuals that were developing blood clots. And unfortunately, I had a blood clot that had traveled to an area in my brain that caused the stroke. But luckily, I feel blessed. I have some mild residual deficits, but considering how things could have been, I feel blessed that I'm still functional, still able to perform most duties as a physician, to do what I love in taking care of patients, and able to be here at this point, not only to share my story about the experience with COVID-19 and how dramatic it can be, but also to encourage people to protect themselves and move forward. One of the things I think when we look at COVID-19 and we look at the data, we look at the statistics, we see most people actually recover. So most people do recover, but on the flip side of that, when you look at the mortality rates, the mortality rate is very devastating. When you look at the families that have lost loved ones and actually have lost loved ones in the hospital that they couldn't even say goodbye to, because of the hospital restrictions and all, that then places an entire mental strain on families. So I think that people need to be mindful of the impact of COVID-19, not just particularly on themselves, but families, friends, other loved ones. So even though, like I said, statistically most people are recovering, there's no rhyme or reason as to who is going to do well and who's not going to do well. And out of those people, the individuals that recover, the disabilities that happen. So even myself. So even though I was lucky enough to not have a fatal outcome of this, it was still disabling to me, with the stroke and my ability to function at my prior 100%. So not only is it something that has been killing people, but I think the disabling numbers are even more so than people recognize. It was a significant period of time between my recovery from the stroke and the vaccine. So my stroke was in April, and the vaccines didn't roll out until December 2020. And from the period of time when that had happened, I had actually been part of different interviews in the past about my experiences. I have been part of different medical discussions as well. And when we talked about the vaccines, at that time in the early summer, spring, it was a feeling that I did not feel comfortable with the vaccine. I said that if a vaccine was to roll out at that point in time, I would not feel comfortable getting a vaccine, because in the summer and early spring, when we were talking about this vaccine rollout, I felt that it was very politicized. So, at that point in time, it was like, we're going to have a vaccine, but there was no data, there was no science, there was no safety that was ever explained along the entire process. And it was just a feeling that, we're going to make this so that you can have it. And as a physician, we always say that we want to practice evidence-based medicine. So, we want to see what's the evidence behind anything that we do or what we recommend. So as time had gone on and the studies have come between Pfizer and Moderna, over 70,000 patients in the studies, and you start to see the safety aspects of things and actually see that you can have 95% protection from COVID-19 after the second dose. I think that then started to become more eye-opening. It was like, okay, what is in this vaccine that is concerning? So when I look at what's in the vaccine does not have the actual virus, so there's no COVID-19 in the vaccine. It's a footprint of a messenger RNA, or like sort of like a protein to make the body think that it's being exposed to the virus. And at that point in time, the body then begins to build a defense. So the immune system then mounts the army to try to fight this virus if it was to be exposed to it. And then the other things that are in the vaccine are just things that just keep this protein stable. So it's, salt, some preservatives, sugar, salt, as well as maybe some fat to try to keep this protein stable so that it can enter the body safely and do its job. So when I look at the risk benefits, so the safety of the vaccine and the risk of COVID-19, right? So what do I rather? Would I rather something that's safe, that they can protect me, or do I want to go through the experience of COVID-19 and unknown of whether I'm going to be one of these people that are, quote, asymptomatic, or am I going to be someone that's going to have some other disease process or potentially even die? Or, again, as I mentioned earlier, even if you don't die, the disability related to it. So do I want to look at, that risk benefit, or do I want to look at, the risk of COVID versus the benefit of the vaccine? And then when I look at the underrepresented communities that have some concerns already, there's been historically, studies that have been performed, particularly with the Tuskegee experiment, and there's health concerns, there's mistrust with government, there's mistrust with the health system. And I think that we really need to identify that fear is out there, that those concerns are out there, and look at the safety of this vaccine, look at the benefits of the vaccine, and address that there are still things that we don't know about the vaccine, right? So I don't know how long this vaccine is going to protect me. Is this something that I may have to do every year? Or is this something that's going to protect me for 3 years, 5 years? That part is unknown, and only time will tell that. But when I look at the things that we do know about the vaccine and the safety of the vaccine, I think that that's something that we need to have a comfort level with, and that's the message that we need to relay out to our community so that we can take the politics and the pressure of just do this out of it, but understanding that this is something that's safe to do. This is something that's going to protect you. And in the long run, you're not just protecting yourself, but you're also protecting your friends, and you're also protecting your family. You're protecting your community. Where do we go next? So as a physician, as an advocate trying to take care of our community, as a patient as well, that's, kind of been exposed to the virus and, the bad outcomes that can happen with the virus. I get the aspect of seeing things from two aspects, right? So from a physician standpoint, patient standpoint, something needs to happen, right? So we need to do better. And it's not an individual thing, it's a community thing. But in order to affect a community, we have to work together. And it starts with you as an individual. And what can you do to impact your community? So what can you do? I think that if you have some issues or concerns, definitely reach out to your provider, discuss it, reach out to family, friends. If you want to reach out to me, and I will definitely discuss any issues or concerns that you have. But the next step is we have to overcome our fears. We have to understand and trust that there is safety here and that we can move beyond this if we all protect ourselves and protect each other. So if you want more information, if you want to know how to sign up and access the vaccine, reach out to the website, covid19.nj.gov/vaccine. I'm Dr. Troy Randle, cardiologist with Virtua Cardiology, but here at the Cherry Hill Free Clinic. If you don't have any insurance or have difficulty with access to care, reach out to us at the Cherry Hill Free Clinic and we can help support you through any illnesses that you have.